Every 40 seconds, someone in the world suffers a stroke. It can happen without warning, turning an ordinary day into a medical emergency. But what exactly is a stroke? What happens inside your brain and body when it strikes? And most importantly, what signs can help you recognize it before it's too late? Stay tuned, because today we're diving deep into the science of strokes. A stroke happens when blood flow to part of the brain is suddenly cut off. Your brain depends on a constant supply of oxygen and nutrients carried by the blood. When that flow is interrupted, even for a few minutes, brain cells begin to die. There are two main types of stroke. Ischemic stroke, which makes up about 87% of all cases, occurs when a blood clot blocks an artery leading to the brain. This clot can form in the brain itself, or travel there from another part of the body, like the heart. The other type is hemorrhagic stroke, caused when a blood vessel bursts, leaking blood directly into or around the brain. This extra pressure damages brain cells and prevents normal oxygen flow. In both cases, the result is the same. Brain tissue is starved of oxygen and begins to die. There isn't one single cause of stroke. Rather, it's the result of several risk factors building up over time. The most common causes include high blood pressure, which weakens blood vessel walls, atherosclerosis, or hardening of the arteries due to cholesterol buildup, heart disease and irregular heartbeat, like atrial fibrillation, which can cause clots to form, diabetes, which damages blood vessels and increases clotting risk, smoking, which thickens blood and narrows arteries, and uncontrolled obesity, poor diet, or lack of exercise, all of which stress the cardiovascular system. Sometimes strokes also occur due to genetic conditions, trauma, or aneurysms, balloon-like bulges in weakened arteries that can suddenly rupture. But whatever the cause, one truth remains. The faster blood flow is restored, the greater the chance of recovery. A stroke doesn't always come with pain, but it always comes with signs. Recognizing them early can save a life. Health experts use the acronym FACE-T to help you remember. F. Face drooping. One side of the face suddenly becomes numb or droops. A. Arm weakness. The person can't raise one arm fully. S. Speech difficulty. Slurred or strange speech or trouble understanding words. T. Time to call emergency services immediately. Other symptoms can include sudden confusion or dizziness, loss of balance or coordination, severe headache with no known cause, blurred or double vision, numbness or weakness on one side of the body. If any of these signs appear, even for a few moments, treat it as a medical emergency. Because with every passing second, brain cells are dying. Let's go deeper inside the body. When blood stops flowing to a specific brain region, that part of the brain loses oxygen almost instantly. Within just seconds, brain cells begin to malfunction. They can no longer send signals properly, leading to loss of control over body parts linked to that region. For example, if the stroke occurs in the left hemisphere, it can affect speech and cause paralysis on the right side of the body. A stroke in the right hemisphere may cause spatial confusion and paralysis on the left side. If it occurs in the brainstem, it can affect breathing, heart rate, and consciousness, often with life-threatening results. As the oxygen-deprived brain cells die, they release toxic chemicals that damage surrounding tissue. This wave of cell death spreads, worsening the injury if blood flow isn't quickly restored. That's why immediate medical attention, such as clot-dissolving drugs or surgical intervention, is critical within the first few hours. Surviving a stroke is just the beginning of recovery. Depending on the area of the brain affected, stroke survivors can experience partial paralysis or weakness, difficulty speaking or understanding language, memory and concentration problems, emotional changes, including depression or frustration, loss of balance or coordination. The brain has an amazing ability called neuroplasticity, its capacity to form new connections and pathways. Through rehabilitation, speech therapy, and time, some functions can return. But prevention remains the best treatment. The best way to fight stroke is to prevent it before it happens. Monitor your blood pressure, eat healthy, stay active, quit smoking, and never ignore early warning signs, because when it comes to a stroke, every second counts. If you found this video informative, share it to spread awareness. You could help someone recognize the signs and save a life.